This segment sponsored by Viking Psychiatry and Wellness. Friday is Purple Heart Day, so we wanted to take the opportunity to discuss mental health challenges and solutions for veterans. And today, I'm so thrilled to be discussing this with Sean Goddard on our Mental Health Matters with Viking Psychiatry and Wellness. Hello.
Hello, good to see you.
You too.
Good.
Okay, so this is really cool that Purple Heart Day is here. Mm-hmm. Why don't you start off by just sharing a little bit about that, especially because you are a veteran?
Yeah, I think we always want to take the time to acknowledge veterans who have served active duty. Mm-hmm. We often talk about veterans, but we forget about all the hundreds of thousands of people that are serving right now at this time. Mm-hmm. But Purple Heart Day is a time to recognize individuals who really have sacrificed a lot for our country and thankfully have been recognized in some way. And I think when it comes to mental health, I did serve myself. I was a 14 Sierra Stinger Missile Avenger crew member in the Army. I got out in '98. And I think one of the benefits of being a provider who is a veteran, right, when veterans come in or active duty individuals come in to see us, is the fact that while everybody's story isn't the same when it comes to the military, mm-hmm, it can be very tiring to sit in front of a provider who doesn't understand what you've been through. Right. And so there's an added benefit of having a provider who understands that and relates to that. I just had it happen yesterday, 2 vets for this new thing, and both of them acknowledged how much easier it was to be able to discuss what was going on, because of my own personal experience as well.
Yeah. And so true, lived experience can really impact someone else, especially in a way of therapy. And so tell me about what is this new thing that you mentioned that you are doing to further assist veterans?
Yeah, we're really excited. We've been what's called a Community Connect member for a while, for the past, since almost we opened, honestly, 2021. And so what that enables is for the VA, if they need services and they don't have enough people to provide those services at the VA, or it's a service they don't have, they can refer people to Community Connect providers to provide those services. And so we've been offering that when it comes to psychiatric care for a while. But we were awarded what's called a VCA contract. And so this specifically addresses the need for care for treatment-resistant depression. And the VA nationally has a policy to treat with ketamine, but locally the VA doesn't have centers that offers that.
Okay.
And so we were awarded a contract about 3 months ago after a year-long process to be able to offer ketamine infusions for treatment-resistant depression for veterans.
Okay, that's interesting. And so when you say that they have a more localized option, I think that's interesting because people can really drive all over for the care that they need and find facilities. So why was it important to bring it local, and are you the only one in this area to do so?
Yeah, it's a really good question, and I think about some of the clients that I have. What really kicked this off is I had a client that was referred to me by the VA to do TMS, transcranial magnetic stimulation, and this vet lives in Indianapolis. And so with TMS, if you remember traditionally, you have to come 5 days a week for 6 weeks. So imagine him having to drive 2 hours one way to get treatment for 30 minutes and then drive 2 hours back, and all the work he's missing to be able to get that treatment for the treatment-resistant depression. And he was frustrated, right? And I was frustrated for him. And I said, there has to be something we can do. For example, ketamine, we could do this twice a week for 3 weeks, and it's a much less burden on you. You can still work. And so this gentleman kind of gave me the incentive to go to the VA and say, what do we do? And it's important because I have vets right now who were already getting ketamine infusions, but they were having to drive to southern Indianapolis, so about a 2.5-hour drive, or to the Mayo Clinic, or all the way up by Mishawaka, Chicago area to get that. So imagine not only do they have to drive there, but they have to have somebody with them because they have to drive them back. They have to be there for the infusion, so they're literally giving up an entire day and missing work, etc., and then family members or whoever are having to do it. And so you should be able to have services that you need right here in your community. And so yes, we're lucky. We were awarded the contract, and we are the only provider in this community within a 2-hour range who can do it.
So what does that look like tangibly when it comes to veteran support? Because I know a lot of the treatment is based on pill-resistant treatment at first. So is that the same process? They would have had to have tried oral medications and been denied it to be able to cross over to the machines?
Yeah, so I mean, the VA is the one who has to ultimately approve it, and they have to give the referral, right? And then I screen them and make sure they're appropriate before we treat them. But in general, what they define as treatment-resistant depression or difficult to treat is they need to have tried and not been successful on 2 to 3 medications, 2 to 3 antidepressants. And so a lot of people think that it means to be able to get services like ketamine or TMS, and that they have to have done 5 or 10 or, really gone to the extremes. But what we know is that once you've been on 2 or 3 antidepressants, if you're not responding, the chances that you're going to respond to another one gets lower and lower and into the single digits. And so we want to take action immediately. And before, the VA really couldn't do that. I mean, they had to refer people, like I said, out of town, and it was kind of a last resort. And now this is an option that doesn't need to be a last resort.
Yes, and what do you say to those patients, to those veterans who are like, hey, I've tried medicine, I've tried treatment. They may feel discouraged to actually give something else a real try. Yeah,
personally, I understand that. I've talked about my experience with depression and the amount of meds that I went through and the lack of hope, and I felt like I was broken and there was something wrong with me. And one of the things that I'm attempting to change in this community and surrounding areas is we're not broken, and the system is broken, the tools are broken. You didn't fail meds, the meds failed you. And so what they need to know is that there are options out there, whether it's with us or with somebody else. Ultimately, it's important that they understand that there is a reason to still have hope, and we can get them care. And more importantly as well, when it comes to even this treatment, as long as they're referred appropriately for the VA, it also means they can get this treatment for no out-of-pocket expense, which is significant as well.
That is a blessing. Wow. Well, so cool that you were able to get this certification and accommodation for veterans, being the first in Fort Wayne to do so. So I hope that you're able to see and help and support the community that you know so well.
Thank you very much.
Thank you for this information. And if you would like more information about Viking Psychiatry and Wellness, we'll have their website listed below and their phone number. Give them a call to set up your consultation, and I'll see you after the break. This segment sponsored by Viking Psychiatry and Wellness.